Celebrating 5 years as the Superior Health Foundation just brings a flood of positive memories. We've touched a number of lives and built a number of relationships across the Upper Peninsula. And in that time, we've enhanced the services of many organizations.
I was able to see that they had funds available to organizations, nonprofit organizations, that needed help to promote positive wellness within their organizations. So being a teacher at a school district where we had so many needs, it was a perfect fit. In the first year, we received our largest, and that grant allowed us to do many things for a program that we had called She Believed, He Believed. In those programs, we were working with a group of students who come from probably the lowest socioeconomic group in the Upper Peninsula. We were looking to promote healthy lifestyles with our students, build self-esteem, make connections with our community, and combat the types of things that teenagers face that are truly serious. One of the things that the Superior Health Foundation supported was a 5K. Staff members and students alike, along with some parents, came, and we went through this process of going through our first 5K together, and it was incredible. We had kids show up that didn't think they would show up. We had students that were clapping and cheering for each other. We had students that cried tears of joy because they had completed something they never thought that they could do. One of the cool things that one of my colleagues came up with was the idea of getting bikes. So we had quite a few donated to us, but what we noticed was that they needed tender, loving care. So we, in our proposal, wrote for a bunch of tools and equipment to maintain and fix those bikes. And what's nice is that equipment that we got from the foundation will last us for years. So this will be a gift that we'll keep giving.
A grant was submitted to Superior Health Foundation and we were awarded nearly $6,400 to start a massage therapy program that would be used to enhance the quality of life that our residents at Omega House have by performing therapeutic massage. The program, we call it our Caring Hands program. It's the first of its kind in our area, and massage therapy is one of the fastest growing complementary or supporting services that's being offered through hospice programs. Individuals facing an end-of-life situation have a myriad of symptoms that could or will show, including anxiety, stress, mental issues such as depression. All of these emotions set in when faced with the fact that you're dying. And we have proven that this massage therapy program takes a lot of those symptoms away. We have had so many positive responses, things like my feet don't hurt anymore, my arms feel alive again, the pain is gone, you're an angel, I can't wait to see you next weekend. It really does help us keep the program going long enough where we can gather data, and that data that shows the program is working wonderfully has already spread to other organizations in our community, and they're finding the value in this program, and we're really happy with that, and we're really thankful for Superior Health Foundation's assistance with this program.
Just Believe was formed in 2013, officially after my daughter Jody Ball had passed away. My son-in-law did the paperwork, and it's a nonprofit organization that promotes the sun safety awareness and prevention for skin cancer. We received from the Superior Health Foundation money for our awareness programming and toward our scholarship that we award every year. And with that money, we were able to conduct sun safety presentation, and I go into the schools and do presentations about sun safety in prevention of skin cancer and things like that. And with the younger kids, it's just more or less an awareness thing, and how the sun safety tips. But with the older kids, we get into the information about the risk factors of skin cancer and prevention, and I talk about my daughter and her experience. I approached Superior Health Foundation with another grant to provide sunscreen dispensers to 10 to 15 organizations and schools districts in Marquette County. There's 2 in Delta County, 1 in Alger County, and 1 in Lance or Baraga County. And hopefully there'll be more.
So our connection with the Superior Health Foundation dates back a few years, where we were a gala participant and gala partner with Jim LaJoy and the Superior Health Foundation. And so they've really been a vital partner in relation to addressing a lot of the unmet needs in the healthcare industry. And particularly, they've been focusing on services that help to augment people that are in recovery or that are on their way to improved health outcomes. Their funding really assisted with the development of our detox unit at our adult residential facility in Marquette. And in addition to that, we've had several other awards that have been around expanding the mental health first aid training initiative, as well as that on trauma services in various communities across the UP. The Superior Health Foundation had awarded us a grant for the expansion and further development of our LUNA program, which is a neurodevelopmental trauma assessment service. And what it does is it takes a look at the functional deficits that are involved with kids that have had severe trauma. The kids that are coming out of that assessment cycle have curriculum and services to go back to in their home communities that really provides their ongoing care and treatment. And so this funding has really played an important part in extending that treatment experience. Some of the other services that go with our Children's and Adolescence Center is around equine therapy. And so what we know with services for children and adolescents is that the more experiential it is, it helps to trigger a different part of their life experience. And combining equine therapy for a lot of the kids that have had severe addiction and trauma issues allows them to express themselves in a way that they haven't before.
Well, for us, we've been in business now for 47 years, and part of our suicide prevention, of course, a crisis line or a suicide hotline is going to be to intervene with people. That's our way of doing suicide prevention, but there's a whole piece that needs to really happen in the community on a grassroots level. And in our entire history, without the funding that the Superior Health Foundation gave us absolutely an unprecedented opportunity to do that. We worked with the health departments, all 6 of them, North Care, other folks, to try to build that capacity in all of the communities so that lay people, professionals, all those stakeholders would come together and just make their communities a much more suicide-ready community to really start with the prevention where it needs to start. So we never would have been able to do that without them.
When we started this grant, most of the Upper Peninsula did not have suicide prevention coalitions, and a lot of the UP wasn't aware of dial help services or other things that were available to them. And because we had this grant, we're able to have an unprecedented reach across the entire Upper Peninsula. There are people trained in every single county in the Upper Peninsula about how to intervene when someone is at risk of suicide, what they're looking for, what are the warning signs, what should I be aware of? And that is something that is pretty significant for a large rural area like we have up here. And even though I can't necessarily measure it, there are people alive today because we had boots on the ground at every county to recognize the warning signs and to intervene appropriately.
We definitely have had people who are struggling with that wanting to live, wanting to die, people who've actually already overdosed before they called us. And we were able to create enough safety for them to admit that, to get emergency services. They had been through our follow-up program. Things are really great. They had moved on from them. Things were well. 6 months later, things weren't so well, and now they were back in critical crisis. But because of that relationship that they had established with us and that sense of safety, they reached out to us again rather than maybe making a decision that would have ended in tragedy. So those are just some of the examples of things that we see every week all the time. And again, the Superior Health Foundation helped us to expand our mission in such a great way.
We're blessed to have a hardworking team and dedicated directors representative of the Upper Peninsula. It's been wonderful in so many incredible ways. Our journey to enrich lives and improve health outcomes is only beginning. We celebrate our accomplishments one beautiful grant at a time.
Because of Superior Health Foundation, the awareness activities that I had thought of, that my daughter encouraged us to do, oh my God, it's just gone way past my expectations. And I'm glad. It's what she wanted.
What the Superior Health Foundation will leave is a legacy of not only helping others, but leaving a legacy of improved health outcomes and health opportunities.
Please, I encourage anyone to support the Superior Health Foundation. Your money is directly impacting folks in the Upper Peninsula.
I had an opportunity to present to the board at the Superior Health Foundation last fall. And before I went in, I tried to come up with the right words and photos to best exemplify the impact that it had. And before I left the building, a student stopped me and said, "Where are you going?" And I explained to him where we were going, and he said, "Please let those people know that we really appreciated all of the gifts we got, but the biggest thing was that somebody believed in us."